Hello, I'm with Cindy. Hey,
Hi.
Cindy.
Hello.
So, why did you come see me?
I was having issues with my left arm. I wasn't able to put it behind my back. I had excruciating pain, and I heard about you and made an appointment.
Okay. So, did you have numbness or tingling in the arm too, or in the fingers, hands, or any of that, or was
None
it
of
just
that. It was just when I went to reach behind my back, the pain would shoot down my arm. And then I would be like grasping it, hurting it. I thought I had some kind of muscle injury originally.
Okay, awesome. So, I mean, we've worked together for how many sessions? Like 10, 12 sessions or something like, or how many?
Probably about around 12.
Okay. And so I want to ask you about the treatment. The very first time you saw me, how painful that was, how like what your experience of that first time, if you can remember that.
Extremely painful. I wasn't sure I wanted to come back because it hurt so bad, but I knew that I needed help. So everything that you touched hurt. Every technique you did was very painful.
Okay, awesome. And how many treatments did it take for you, more or less, before it didn't hurt so intensely?
I'd say probably halfway through. I mean, I could still feel it, but I could see that every time I would come, the pain would lessen.
Okay.
I could almost immediately tell the mobility I had in my arm and the sharp pain in my arm went away. But then you helped me gain mobility by continuing coming.
Nice. Okay. And so today we've completed, let's say 12 or something, maybe a couple more treatments. And did your treatment hurt today, or what was your treatment experience? Not like on the side that we have been treated for a while.
It didn't hurt. The little shave tool that you use, I actually was able to go through it without any pain, which is huge. That thing hurt me from day one. I cringe every time I see you pick it up. And then today you were able to do the whole left side without me cringing.
Yeah.
So yeah, huge.
Awesome. Well, I'm so glad you're better.
Me too.
Yeah.
Thank you.
Thanks, Cindy.